Hi, this is Bob Siriani. I'm the proud chair and program director in the Department of Speech Language Pathology at Salus University. I'd like to wish you a happy Better Hearing and Speech Month. This year's theme is communication at work. And I'm sure in this world that we live in, you're finding communication is work. Whether you're face-to-face, mask or no mask, or you've moved virtually, using a variety of platforms or a phone to call or text, you're finding that you're working harder to make sure you understand the person on the other end, as well as to make your needs known. Well, speech language pathologists are the experts in communication. We evaluate, diagnose, treat, and counsel a variety of communication disorders that impact speech, language, voice, fluency, cognition, and swallowing, among other things. So in these days, when you're really thinking about communication, think about the profession of speech language pathology and recognize communication at work.
Hi everyone, here's another cool fact. Did you know that speech language pathologists were ranked number 6 for the best healthcare jobs by the U.S. World News Report? I think that's pretty cool.
Happy Better Hearing and Speech Month. I'm a speech language pathologist. My name is Trish Mayrow, and I want to talk a little bit about the specialty that I have in speech language pathology. I am a specialist in childhood apraxia of speech, which is a motor speech disorder that affects the planning and programming of movements for speech. It's a serious disorder that requires the expertise of a speech language pathologist to help children find their voice.
Hey everyone, did you know that childhood apraxia affects 1 to 10 kids in every 1,000 children and 3 to 5% of speech impaired preschoolers?
My name is Jackie Pittum. I am a clinical educator at Salus University's Speech Language Institute. I also work as an SLP at the HMS School for Children with Cerebral Palsy and in private practice with adults who have complex communication needs. My areas of specialty include AAC, which is augmentative and alternative communication, literacy instruction, multidisciplinary collaboration, and parent-professional relationships. I have also done work in feeding and swallowing, as well as adapting social communication curriculum for individuals with physical disabilities and complex communication needs. The key to successful intervention and evaluation in these areas is individualization, collaboration, and flexibility. And always be open to learning something new.
Did you know that dyslexia is common among kids with mixed receptive and expressive language issues?
Hi everyone! Did you know that communication disorders affect approximately 46 million Americans?
Good morning, and happy Better Speech and Hearing Month. My name is Ken Newton. I'm an ASHA certified speech language pathologist and also an assistant professor at the Salus University Speech Language Institute. Most of my career has been in pediatrics with also adult work. I've focused most time in school-based therapy and enjoyed immensely working with children with autism and children with fluency disorders. One area I've noticed that I was able to link in working with my clients is the importance of having family involvement in both children with autism and children with fluency disorders. It's important that we educate the parents and teach them strategies to use at home in order to have the best outcomes.
Did you know that 5% of all children go through a period of stuttering that lasts 6 months or more?
Did you know that over 3 million Americans stutter?
Hi, my name is Kim Edmonds and I'm a pediatric speech language pathologist. Over the past 10 years, I have worked with children and their families in a variety of settings, but I currently oversee 2 preschool programs that support speech, language, and early literacy skills in children ages 3 to 5. I'm also bilingual in Spanish, and I have specialized training in working with families that speak more than one language at home. There are a lot of misconceptions out there about bilingualism. Mainly, people tend to think that it causes speech or language delays or disorders. That is absolutely not true. So part of my role as a bilingual SLP is to help families figure out whether their child is experiencing the normal process of learning a second language or if they do have a true speech and language disorder that needs to be addressed.
Did you know that children learn 80% of their language by the age of 3? That's why early intervention is so important.
Did you know that the prevalence of speech, language, voice, or swallowing disorders is highest among children 3 to 6 years old?
Hi everyone, my name is Kelly Salmon and I am an assistant professor in the Department of Speech Language Pathology at Salus University and a speech language pathologist with over 17 years of experience. Over the years, I have worked towards specialization in the area of swallowing and swallowing disorders and have been a board certified specialist in swallowing and swallowing disorders since 2011. I have further specialized my practice to serve individuals with head and neck cancer, working with these individuals on maintaining and improving speech, voice, and swallow function. I am one of only a few speech pathologists in the United States certified through the Lymphology Association of North America as a certified lymphedema therapist. Being a speech language pathologist is such a rewarding career, and I am excited to continue practicing and educating future generations of speech language pathologists for years to come. Happy Better Hearing and Speech Month.
Did you know 25 to 45% of typical developing children demonstrate feeding and swallowing problems?
1 in 17 people will develop some form of dysphagia throughout their lifespan.
Hi, this is Beth Davidoff, Assistant Professor in the Department of Speech Language Pathology at Salus University. My area of specialization is Augmentative and Alternative Communication, or AAC. I work with infants, toddlers, children, adolescents, adults, and older individuals who are unable to meet their complex communication needs effectively through spoken language. This may be due to developmental disabilities like autism, cerebral palsy, Down syndrome, or other genetic disorders, or to acquired disabilities like aphasia, ALS, and traumatic brain injury. AAC options range from no-tech communication boards and manual signs to high-tech communication devices with speech output.
Did you know an estimated 1.3% of Americans, which is about 4 million people, cannot reliably meet their daily communication needs using natural speech?
Did you know that 1 in 5 Americans has hearing loss in at least 1 year?
Hey everybody, it's Annie. I've been at the SLI for about 3 years and in speech therapy for a little under 10 years. I have spent most of my career in the rehab setting, working on both inpatient and outpatient basis. My specialty, I would say, is brain injury / concussion with stroke and spinal cord injury following a close second behind. With the brain injury population, especially on the inpatient side, you're really just trying to help return the ability to communicate basic wants and needs, understand that the injury has occurred, and help the patient understand what that really means for them functionally in this moment, as well as maybe down the road. Trying to help them understand that life is different and just really support them and provide therapy so that independence can be achieved in every way possible at the highest level that it can be.
Know that approximately 1/3 of strokes result in aphasia.
In the United States, approximately 500,000 children in the age range of 0 to 14 years are admitted to emergency rooms each year as a result of a traumatic brain injury.
Did you know in the United States there are over 5.7 million people living with dementia who may need speech and language services?
Hi, I'm Amy Lustig. I'm an assistant professor of speech language pathology at Salus University in Elkins Park, Pennsylvania, with a greeting for Better Hearing and Speech Month during this incredibly challenging 2020 season. I want to start by giving a special shout out to our graduate students for their amazing resilience and flexibility with the changes we've recently had to make to our teaching and learning methods to accommodate the COVID-19 crisis. The fact that they've reached out to our university faculty and clinical educators to participate in this Better Hearing and Speech Month activity tells you that they're capable of looking beyond their immediate needs to the issues that affect our field as a whole. We are very proud of you all. This year, Better Hearing and Speech Month is occurring right in the heart of the COVID-19 crisis. We're all feeling the effects of this pandemic in our personal lives, and some of our colleagues are also working in hospitals and rehabilitation settings, providing direct care for patients stricken with the virus. Part of being an engaged clinician is knowing how to advocate for our clients, especially for those who are unable to do so effectively for themselves, and to address the fullest range of their needs as possible. As a field, we have had a rapid and well-informed response to COVID-19 in the form of collaboration with other medical speech pathologists located in the U.S. as well as abroad to identify best practices for this unique time. I want to take a moment to highlight one response to this crisis, which is now available for hospitalized patients and families to maximize their access to communication with one another. There is a new remote communication format called COVID Speak, which actually stands for Collaborative Video Speaking, though it's no accident it also matches the name of the current virus. It was developed and quickly distributed by two individuals named Bill Binko and Brian Whitmer, who themselves had personal experiences with trying to communicate with hospitalized and intubated loved ones. The COVID Speak website and product is sponsored by Cough Drop, a company that provides web and app-based solutions for those with complex communication needs. Treatment for COVID-19 has resulted in large numbers of people requiring mechanical ventilation as part of their treatment. When people are attached to a ventilator, they're typically unable to use speech or voice for communication purposes unless special accommodations are made. Such accommodations can often be challenging to put into place and are likely nearly impossible in the current ICU environment. Additionally, being acutely ill and hospitalized puts people at increased risk for adverse events such as delirium and disorientation, which can be made even worse when no contact with familiar loved ones is possible. Unfortunately, right now there is an even higher risk of this occurring than is usually the case, as hospitals and other inpatient care facilities have currently banned visitors due to COVID-19 infection risk. COVID Speak is a free, web-based conferencing strategy that allows patients on ventilators or those with other communication barriers to engage directly with family and friends in real time and to make emotional connections that would otherwise be impossible. Here you see an example of what the shared screen looks like. I want to thank you for watching our video from Salus University. And I want to encourage us all to be alert to opportunities to advance our practice of creative communication solutions. Have a great, better hearing and speech month, and please be well and safe. Take good care.
Stay safe. We miss you.
We miss you. Stay safe.
Stay safe and stay healthy.
I hope that everyone is staying safe and healthy during this difficult time, and I can't wait to see you soon.
I miss everybody. Stay well, and hope to see you all soon.
Miss you all, and hope everybody is staying safe and healthy.
Happy Better Speech and Hearing Month. Stay safe and healthy.
I hope everybody in the Salus community is staying happy and healthy during these hard times, and I'm looking forward to the day where we can be together again.
I wish you all good health. Please stay safe.
I hope that everybody is staying safe, healthy, and positive during this rough time, but I know we're all going to get through it. I can't wait to see everybody soon.
Happy Better Speech and Hearing Month. I miss you all. Bye.
I hope everyone is staying safe. We miss you.
Esperamos que se encuentren bien y los extrañamos mucho.
Happy Better Hearing and Speech Month, and stay well.
I hope everyone is staying safe and healthy during this time, and I can't wait to get back to SLI and see you all. Thank you.
And on behalf of the students in the speech language pathology community here at Salus, we hope everyone has a great Better Hearing and Speech Month, and we hope everyone is staying well and staying safe, and we can't wait to see you all at SLI very soon.